this course, you will learn the acronym RAIN, how to recognize a contaminated patient, recognition, and what to do when a contaminated patient shows up, avoidance, isolation, notification. In addition, you will learn basic decontamination goals and procedures. So what is contamination? A contaminated patient is an individual who has detectable amounts of a hazardous substance on their skin, hair, or clothing, and may inadvertently pass those contaminants to others if not properly managed. On the other hand, individuals exposed to a hazardous substance but not contaminated may experience adverse symptoms from the agent, such as a cough or shortness of breath, but cannot injure others. Continued exposure to a hazardous agent poses a health risk to the victim as well as those responding to their aid. The risk of exposing or contaminating others can be minimized by proper isolation and decontamination of the affected individual. Contamination can occur in a variety of ways from a diverse group of toxic agents. Household cleaners and industrial chemicals, pesticides and herbicides, petroleum products, biological hazards, and radioactive materials are some examples. The most common cause of contamination is human error, especially during the handling and storage of these materials at fixed facilities, such as a residence or workplace. Contamination can also occur from transportation accidents, industrial spills, criminal acts such as illicit drug manufacturing, and natural disasters. When a person comes in contact with any contaminant, there is the potential for that contamination to be transferred to you, your coworkers, other patients, or the hospital itself. This secondary contamination is what emergency decontamination is designed to prevent. Secondary contamination can be just as hazardous to you and your coworkers as primary contamination. Contaminants vary in toxicity and effects, so it is difficult to predict the effects on your health, but in general, all secondary contamination is to be avoided. The acronym RAIN, which stands for Recognition, Avoidance, Isolation, and Notification, can be used by individuals to quickly gather and process information and to synthesize the information in order to facilitate immediate actions when faced with a contaminated patient at your facility. Recognize the hazard or threat. Victims will arrive at your facility in a number of ways. Many times they arrive unannounced without the assistance of pre-hospital emergency responders. Therefore, the hospital first becomes aware of a chemical incident when the first contaminated individual or individuals arrive seeking care. Not only is the contaminated victim now a patient, but if they were assisted to the hospital by another person, that individual may also require some form of decontamination as well as a medical evaluation. There are many clues to help you recognize a contaminated individual. First and most obvious would be if you were told by the patient, someone they arrived with, or EMS that they were contaminated. However, many times patients may not even be aware that they are contaminated or that it's important to make you aware that they are. Your senses will probably offer the best clues. Contaminants often have odors. Contamination may be visible on clothing, or the patient may be complaining of conditions such as breathing difficulties, skin irritation, or burning eyes. You may have information from the media or from emergency responders that a release has occurred in the community, and you should be on the lookout for patients presenting with specific signs and symptoms from the contamination described. Avoid the hazard or contamination. You need to be aware of the initial actions to take to avoid liquids, powders, or vapors which might be associated with your patient's clothing. Isolate the hazard. You need to know the initial actions to take to isolate or reduce exposure to any contamination or exposure threat. It also serves to keep people from going into close proximity to someone potentially contaminated. Notify the appropriate support. You need to know whom you should notify within the hospital, giving them as much information as possible about the patient to help ensure the appropriate response is initiated. The primary goal of patient decontamination is to protect you, your coworkers, and your hospital by redirecting the contaminated victim to the outside of the hospital first and then ultimately removing the contaminant from the victim. Your facility is required to prepare a document called an Emergency Operations Plan. This plan should include the results of your Local Hazard Vulnerability Analysis, or HVA, that should identify your facility's risk of seeing contaminated patients. In it, you should find details of exactly what to do when faced with a contaminated patient. If you are unsure, ask your department manager for direction or request a copy of the plan. The first thing you need to do is to think about your own protection. To avoid becoming another victim, some basic rules apply. First, don't ever touch the contaminated patient. Ask them to stop where they are and direct them outside via the nearest exit to the area designated in the Emergency Operations Plan. Notify the appropriate person within your facility that you suspect a contaminated patient has arrived at the hospital and escort from a distance the patient outside. Given the patient's state of mind, it would be helpful to calmly tell the patient why they are being escorted outside, as this is not a usual protocol for patient care. Stay with the patient until someone on the decontamination team arrives. Stay 3 to 6 feet away and stand upwind of the patient, and ensure no one else approaches the patient from a downwind direction. That is, stay close enough to speak with the patient, but in a way that the wind is blowing from you to them. After the patient is isolated from the rest of the hospital, they can be decontaminated or cleaned up based on what is on them and the severity of their condition. Let's see if you remember what we just discussed about handling a decontaminated patient. 6 statements are listed here. Some are true and some are false. Drag and drop each statement onto the correct category. When you are finished, click Submit to check your answers. Decontamination can be done in a number of ways. The quickest and often the most effective way is to remove the person's clothing. Studies have shown that much of the contamination is in a patient's clothing, and further injury and symptoms can be slowed or relieved through simple clothing removal. Your hospital will have procedures in its Emergency Operations Plan detailing methods for clothing removal and containment, and ways to protect the privacy of the patient during the process. Your plan will also spell out the procedures for performing soap and water decontamination. This simple procedure may be accomplished by using portable showers, showering within a permanent decontamination room, or in some instances by using a domestic shower in the emergency department. Personnel performing this procedure will require appropriate chemical protective clothing and respiratory protection. The make and style of this personal protective equipment will be addressed in the Emergency Operations Plan and should be based on your facility's HVA. The patient will be assisted through this process by your coworkers who have received specialized training that goes beyond this orientation. You should never attempt to do soap and water decontamination without first becoming a member of the decon team and completing the appropriate level of training. You may be called upon to offer support to those who are actually conducting decontamination. This may include securing the decontamination area, setting up equipment, or supplying the team with towels, sheets, blankets, food, or water. For this reason, you should at least be familiar with the location where decontamination will be conducted, basic procedures, security measures, and your responsibilities. Again, this information should be included in your hospital's Emergency Operations Plan. It is likely that the area where decontamination is being conducted will be closed to all persons not directly involved in the procedure. At a minimum, you should know to stay away from the decontamination area during and after the event unless you are assigned specific duties in the decon process. You should be prepared to follow safety instructions, help maintain patient privacy from onlookers, and be familiar with your facility's Emergency Operations Plan. This course gave you the basics of your responsibilities during an incident involving contaminated patients. Learning the acronym RAIN will help remind you of the critical first decisions that need to be made when faced with the contaminated patient. You should now know how to recognize a contaminated patient, understand the importance of avoiding direct contact, where to isolate them, and who to notify. Your facility's emergency operations plan will give the customized instruction for performing all of these tasks.